Good afternoon. This is Manisha Pradhania. I'm the editor for BabyChakra. And on behalf of BabyChakra, I would like to invite everybody and welcome everybody to the chat. Our topic for today is how safe and how safe are menstrual cups and how do we use it. So we have our experts here for the day. We have Dr. Ritu Sharma, we have Dr. Debalina Roy, and then we have Swapnil Dwivedi, who's an influencer and entrepreneur. Let's begin by giving a little bit, telling you a little bit about Baby Chakra. So Baby Chakra is one of the most loved websites and portals, and also we have this. It's a community where we have moms and experts coming and talking about parenting and everything you need to know about parenting. So we move on now to our experts. Would you like to introduce yourselves, please? Dr. Ritu, will you go first with you?
Yeah, good evening. This is Dr. Ritu Sharma. I am a consultant obstetrician and gynecologist at Bangalore, Vividis Hospital.
Dr. Ritu, I'm so sorry to stop you in between. Can you just be a little louder?
Yeah, I'm Dr. Ritu Sharma. I'm consultant obstetrician and gynecologist at Bangalore in Vividis Hospital. And today I'm here to talk a little about menstrual cup and give some awareness about it.
Dr. Debalina, please, can you introduce yourself?
Hello everyone, this is Deblina Roy. I practice in Delhi. I'm a consultant obstetrician and gynecologist. And I thank BabyChakra for being such a wonderful platform which scientifically actually helps the parents and creates a group where scientific discussions go on. And it is very much required in today's thing where Google is the biggest knowledge provider and people lack the basic things. And thank you for giving us this opportunity to be here.
Thank you. Swapnil?
Hi everyone, I am Swapnil Dwivedi. I am an influencer and I am also an entrepreneur. I run a women community where I host events and all for basically for Bangalore moms. So it's like meet and greet and kids play date. And yes, and thank you Baby Chakra for giving me an opportunity, for sharing such a great platform and discussing on the topic menstrual cup.
Thank you so much. So we move on to our questions. We can start with Dr. Ritu Sharma first. If you could just tell our viewers about menstrual cups. What are menstrual cups? If you could explain a little about it.
Yeah, so the need of the hour is girls and women, what they require is an effective, a safe, and also a cost-effective alternative to these normal sanitary pads or napkins that they use. So about 26% of our population is a menstruating population, which is a sign of good reproductive health. So mostly all these women, because of ignorance or probably prejudice regarding and fears regarding the safety of these products, that most of them are not trying the variety of menstrual products that we have. So it is, although it is very age-old thing, menstrual cup, it is not very commonly used among people because of these reasons. But what I can tell is menstrual cup is a very safe alternative because it is most likely made of a medical grade silicone, and it can collect about 10 to 38 ml of menstrual blood, which is a normal menstrual blood flow during each cycle. So and it can be changed once in 6 to 12 hours depending on each menstrual flow. So this silicone is a very inert substance which is used in many of the medical implants. So it does not cause any harm as such. So many of women have this doubt regarding the safety of its use and thinking it can cause infections. But then the recent studies actually prove that there is a lesser incidence of infection with the use of this, and all that smell with because of the pads reacting with the blood products is not there in menstrual cup. And also many women will also have many skin rashes, dermatitis because of prolonged usage of pads, which is absolutely not the case with menstrual cup. And most importantly, it is also very pocket friendly because you can just buy it once. The cost is about 400 to up to 1600, but it can last for about 10 years. So that is a thing about it. And also it's environment friendly, because all these pads we dispose every day, about 17,000 pads, all that is a very bad waste. So instead of that, we can use menstrual cups, where you dispose it only once in probably 10 years. So
Thank you. Dr. Deblina, would you like to add more to that? And would you like to also tell our audience why you would recommend menstrual cups instead of
Yes.
the sanitary napkins? Yes.
Yes, definitely. Our population of women are not that aware regarding menstrual cups, and menstrual cups themselves are safe. But the red flag signs, which we all women should know, is there are manufactured instructed duration. Like some can be used for 4 hours, 6 hours, 8 hours, or 12 hours. Nowadays, long duration ones are available, so they can be used. But for proper hygiene and sanitation purposes, that more than 6 to 8 hours, it is not advisable much to use, because the blood gets collected. And proper use, as we will be discussing later, hand washing, proper using, maintaining sanitation, a proper perineal hygiene. This is the basic requirements which needs to be told. And yes, menstrual cups can be used. They can be worn anytime, and there's no sign of soakage. That helps. Soakage thing, that is the biggest worry that we have for heavy period days. So that is not there. But definitely, if there is any undiagnosed vaginal bleeding, the patient is suffering, a woman is suffering from any recent infections down below. So in those cases, menstrual cups is not advisable, or any procedure down below if the woman has recently undergone. So those at those times, menstrual cups may not be advisable. But other times, with proper precautions, proper knowledge, proper awareness, this is a safe one.
Thank you. Dr. Deblina, there's some kind of an echo while you're speaking. I don't know if you've left the phone on or something. Could just check.
Is this?
So we'll see that. Okay. We move on to Swapnil. Swapnil, I have you ever used menstrual cups, or are you planning to switch to menstrual cups? Uh,
So to be very frank, I have not used it yet, but
yes,
recently I had faced one issue like the rashes. So I consulted my gynec and she told me to switch to menstrual cup.
menstrual
And
cups.
so I'm planning to, start it this time. So let's see how it goes. It actually I was planning to switch it before, but there was something on my mind, like I wasn't able to. Maybe the factor of comfort or discomfort. So because of that, I wasn't able to switch it. But now after that, issue happened with me. So yes, I'm definitely planning to switch.
Okay.
Yeah.
Um, So, Ritu, is it safe to use menstrual cups even while someone is exercising or doing the yoga or swimming? Is it safe to use that? I'm sure a lot of ladies would like to know that. A lot of moms would like to know that.
yeah, absolutely, it is safe. In fact, for women who are actively physically exercising, who are into sports, I would absolutely recommend menstrual cups, because there is lesser incidence of leakage if used properly in this correct size. There is actually lesser incidence of leakage, and also this is a way that we can motivate school-going girls into all these activities without any fear of leakage or any such things. Menstrual cups, also the duration in a normal menstrual cycle, like mentioned, up to 6 hours, there is usually no problem with the usage of cups. So I would definitely recommend it for women who are very physically active in sports.
Dr. Debilna, the next question is for you. Is do the menstrual cups come in one size fits all, or are there different sizes for different reasons?
No, there are different sizes. First, when you start off, you might have to go for a trial and error, starting with a small. I'm like holding a smaller one.
Yes,
So
that
you have bigger ones. Depending on when you have childbirth, you need bigger ones. When you have vaginal deliveries, mostly women have undergone vaginal deliveries, they require bigger cups. But if you have not have any deliveries vaginally, or you have just started your sexual life, in those cases, the smaller ones can go. But definitely, it's a trial. The whichever fits first, that should be taken.
So there are different sizes.
Yes,
There are
multiple sizes. You need to assess, and you have to actually insert two fingers down below. You see one finger, two finger, and then you measure the cup size. Like you go ahead, and then the inches you get. So from small, medium, you go ahead. This one is a smaller cup, just
yes.
two fingers is going, so it will depend. And if you, and it always happens, like sometimes you might have a wrong estimate, so that cup falls down, so it may be small one, so you go ahead with a larger one. So you have two cups. You first time it can be a trial and error, but later on it becomes used to.
Okay. Swapnil, so since you said you haven't used them, I'm sure you've heard a lot of stories from
Exactly.
other moms who've used them.
Yes.
Any kind of myths that you've heard regarding menstrual cups? Any kind of, things that scared you probably to not go ahead and use it? Have you heard something from your
Yeah, maybe
friends or
the
other
process
people
of
who use?
fixing it, like how we, how we go and fix it. So that is the one thing. And another thing, there is one, small portion that comes out. So I feel like, it might be a discomfort for anyone who will be wearing it, who will be using it. So yes, and the advantages are like more, maybe, it is eco-friendly, it is, it saves a lot of your money. And yes, you can wear it if you are exercising, if you are, want to go inside the pool. So yeah. So one thing that I still scares, that is the one thing, that one pipe comes out of it is really scares me a lot. Like how and why, and like how to manage with that situation. Like, can we cut it, or can we, like, or we have to use it that way only? So that is the one thing.
Have our experts who are just going to be talking about that.
Exactly.
Dr. Ritu, how often does one empty the menstrual cups? How often does one need to empty the menstrual cups?
Yeah, depends on each one's menstrual flow. So usually up to 6 hours, there shouldn't be any problem in a normal cycle, unless they have really heavy menstrual bleeding or something is wrong. Usually up to 6 hours, there shouldn't be any problem. And sometimes even unless you have a heavy flow, once you wear it in the night, you can even have it up to 12 hours.
Okay, so one can wear it up to 12 hours, is it?
Yeah.
Dr. Debilina, you've already told us how this about the sizes. Can you give us a little brief about how does one insert a menstrual cup?
Yeah, sure. Well, I have a menstrual cup with me. This is actually medicated silicone, as already said. So this you actually have to fold in the way of a shape of a C.
All right.
I hope everybody can see it.
Could you please bring that closer to the camera so everybody can see it? A little above, on your right, on your left. Yeah. Yes.
This is how you fold it.
You'll have to come towards your left. Yeah.
You
Yes.
get
Okay.
it? Yeah, this is the C that you have to make.
All right.
Okay.
All right. Suppose imagine this is your the vaginal end. What people do is they try to push it straight or upwards. Okay, don't go like that. Always imagine your tailbone. So go down below. Yeah. So
Yeah.
point the C towards down your tailbone. Imagine your tailbone position. It is nothing big. Just you insert it inside. It inflates on its own.
Ah, okay.
Okay.
Just a sec. So this is what happens. Now you have a worry about this. Okay.
Yes, that
So
that
how
was
do you know it is in
important.
the correct position? If your uh, menstrual cup is not in proper position, it will be still folded. You will feel it. Okay. If it's not in proper position, so what do you need to do? You have to rotate your fingers down. So you can feel a globular thing. No, this has already inflated. It has opened up. The entire cup is open. You can see this.
Yes.
But if it was folded, you would feel some rugosities and irregularities here. So you need to just rotate your fingers here, and you will feel the entire ball here.
Hmm.
And regarding this, in some women, this actually protrudes out, and in some it goes inside, depending on the pelvic cavity, the vaginal cavity. Okay. The one thing is you need not cut this, because if you cut, it will leak, and this
Oh,
will not cause any problem. Yes, after you insert a menstrual cup, you have to be comfortable. You should cuff like you give pressure in your tummy, like you cough, you jump. So if the menstrual cup is in position, it will not fall down, and you won't feel. And you go to the means you go to the toilet to pee. If you are able to pee and you jump and laugh, then without any discomfort, then it is right. But if you are having any discomfort, like it is pricking or something, then this is not in the right position. This will never prick you. This is actually malleable silicone, no? So this will never prick you or cause harm. Even with sexual intercourse, this will not cause any harm to the partner or to you. This is not a cause of concern. But if it is disturbing you, then the position is not right. Then you have to remove it. You have to try another position. Maybe you have inserted in the wrong way.
All right.
So, like, how many ways can we insert this menstrual cup?
This is actually, you fold it in any way. You can, this is a C. This is a C. This is the most likely way of inserting, the simplest one. Now, if
Okay.
you want, you can fold it 2, 3, like bigger cups. Suppose your pelvis is long, so your cup will be more big. So you can fold
Okay.
it in 3, 4 fashions, just like this, and just go inside. It is just like a cavity. Nothing, just go down and it opens. It is similar to your down below passage. The vagina is similar to this, which I am holding. It's just a bottle cap, but your vagina is like a muscular thing. It will expand.
Okay.
So,
Okay.
so this is just, you fold it in the C, you
Okay.
point it downwards towards your tailbone, just release it, and the cup itself, it fixes it. You can
Okay.
push it if you wish. Your tail is being a bit outside, you can
Yeah.
push with your finger and see it goes inside.
Okay. So we cannot cut the tail, right?
No, don't cut,
We
because
should not.
this is the seal. It will harm you, and then if you cut it,
Okay.
there will be rough edges and it
Okay.
will hurt your vagina. It will cost
Okay.
you. If you cut this, it will create rough edges and it will hurt your vagina.
Okay. Okay.
What are the chances of leakage, Dr. Debilina, and how does one avoid that?
Actually, the thing is, it depends on the capacity, but definitely in your heavier days, you should be like in the day 2, 3, and 4. Usually, 2 and 3 are the days when you have heavy flows. So, in those days, ideally by 4 to 6 hours, you should evacuate. And definitely, before you start, the most important thing, you wash the cup
I
under
was
tap water, and that is the best lubricant. Sometimes you have hard dry vagina and your difficulty. The best time is when you are in the shower. Your this cup should be wet in water, any tap water, and in that wet state only you have to insert it in the vagina.
all right.
That is the best position to insert it, and
Okay.
best time. And always, whenever you have a feeling that it is filling up in your, always when you empty, you need to wash it, wash your hand, and then insert, and again wash your hand for proper hygiene.
Yes. So coming to hygiene, I was just coming to the hygiene part of it. Dr. Ritu, can you give us a few tips for the do's and don'ts for hygiene while using a menstrual cup?
Yeah, like
I
mentioned,
mean,
wash your hands and make sure that your hands are clean, even before insertion or before removal. So that is the main reason why there is infection rates with menstrual cups. It's our own hygiene. Use clean hands, and once the menstrual cup is removed, wash it with tap water and soap. These days, there are solutions available to wash the menstrual cup also. And once it's removed and it's washed, you can reuse it again. And after every menstrual cycle, you need to sterilize it. Like you can just put it in boiling water for up to 10 minutes. These days, there is equipment to even sterilize that menstrual cup. For they claim that in 5 to 7 minutes, the menstrual cup is again clean. So make sure that this is done after every menstrual cycle and before reusing it again.
okay. Dr. Deblina, what about public washrooms where there is no option of sterilizing? Some public washrooms, there might be a shortage of water. So, what does one do in such a situation when the menstrual cup is full and one wants to, clean it? So, what are the steps for that?
And the first thing is, tap water you will be getting. Tap water is the only thing to clean. And if at all tap water is not there, tissue paper, or you have facial
I,
tissues. And but there are other options. These are just they are not the proper way. Always tap water cleaning is the preferred one. If at all it is not possible, then you have to do away with, nowadays, sanitized tissue paper, sanitizer everybody is carrying. So
what about wet wipes?
Yeah, wet wipes you can use. That's what the sanitary wipes that you're getting. You can wipe with those. But ideally, plain, simple tap water is the most thing, because some people with sanitary wipes also, you don't know the ingredients. People use perfumated ones. Again, in perineal hygiene, we are not
What about
supposed to use
ones
those.
that are organic, maybe like we have in Baby Chakra,
Yeah,
the
that you
organic
can
ones?
do because it's organic is okay. But if you have those perfumated ones and all, then they cause again different type, various rashes in the vaginal region.
All right. So, there are some people in the audience who want to know that can it cause infection? Prolonged use of vaginal
Yes,
cups, does it cause
yes,
infection?
that.
And what are the precautions?
Yes, definitely. If you use the cups for more than the recommended times, nowadays it is always preferable not to use more than 6 to 8 hours. Yes, overnight when you are sleeping, it is okay after 12 hours, but you have to remove it. There are times when people neglect, okay, it is continuing, I'm keeping it, but you have to be very concerned that there is no leftover menstrual cup. Like people forget after 4 5 days when the cycles are over, the cup is in place because they're comfortable with that. Then
Correct.
you are having a prolonged any you have certainly itching over the region, any pain, rashes, and
Correct.
down below discharges. So those things are some things, or sudden onset of any diarrhea, any symptoms of acute pain abdomen, any so these symptoms are again signs of sepsis, which happen in cases of neglected cups. So those are the things which one should be aware of. Like any infection, if they are having, then it's better to avoid.
Okay. Dr. Ritu, is there a certain way to choose the correct menstrual cup? Because I'm sure there are many available. So, is there a way to choose it?
Yeah, like mentioned, even unmarried girls who are not sexually active, they also can use this menstrual cup with smaller diameters. So those have a smaller filling capacity, and also they're smaller diameter, and the length is also smaller. So they come
Yes.
in small size. The sizes are small, medium, and large. So the smaller size can be used about 18 years or those who are not sexually active. There is also a medium size, and that can be used by just sexually active women or those who've had not vaginal birth but cesarean sections. Those women can use the medium size ones. And the larger ones are usually for women who've had vaginal deliveries, normal deliveries. Those women can use the larger size. But it's not just about this. There are other factors as well, like mentioned cervical length. So, like introduce one of your finger and look for your cervical length, based on which also you might have to use a larger diameter. Also, there is another factor, that is your menstrual flow. That is, if you have a very heavy flow, then you might have to choose a bigger diameter. So, based on these three factors, you choose which menstrual cup suits for you.
All right. Um, Swapnil, now have your views on menstrual cups changed after
Yes.
the discussion? Do you
And I
think
have one question as well. So, like, how we should keep the menstrual cup after the use?
Yeah, you get a cloth bag actually. Once it is sterilized, you get cloth bags. Usually, it is available with every menstrual cup. Usually, these days, all brands are providing that cloth bag. You can store it
Okay.
in that.
Okay. Okay. So, before and after use, we have to sterilize it, right?
Yes, yes.
Okay.
After every menstrual cycle, you sterilize it once. That's it.
we
Okay.
have a question from the viewers? Someone wants to know what about the smell? Sometimes what happens is even after they take the menstrual cup out, there is a certain amount of blood that is remaining. What about the smell? What about the blood?
Uh, yeah, once you wash it, you use soap solution to wash the menstrual cup, so there shouldn't be any smell with that once if it is properly cleaned.
Another person wants to know that is it hygienic that the blood is in the cup for so long? Uh,
Why don't people ask the same question with pads? Pads also you use for
Exactly.
such prolonged hours, and that is the one which gives the odor, because the menstrual blood
Correct.
reacts with the contents in the pad and all that, and people actually have more smell with that. You go to public toilets in the dustbins, they stink so badly. Such problems are not there with menstrual cup. Also, the smell and the infection rate, everything is the same thing. You just have to use that proper precautions in using it. There's absolutely no problem of smell.
Okay, so anyone can use it, right? There is no restriction, like in case someone has an IUD, while having an
No,
IUD,
no,
can they
no.
use it? Is what the
Yeah,
question is.
absolutely they can use it even while pulling out. If it is, because of the suction that's created, like mentioned, it has to be properly pinched and removed. So that suction will be off. Like there will not be any suction unless, it is removed in a wrong way. The copper T will not be coming out. IUDs with menstrual
It's
cup,
safe.
it's absolutely safe.
So, could you give us a few key takeaways for our viewers, Dr. Devilina, Dr. Ritu, and Swapnil?
Before we go ahead, I just want to, ask one more question. So, as you all told, there are three different types of cups. So, and we have to choose the cup as per the flow, as per the vagina size, and yeah. So, like, what if someone is having, less flow but has maybe a bigger vagina or something?
They can still use the larger size. There's no harm.
Okay,
Maybe you can use it for a little more time. Just that there'll be less amount of blood which is collected in the cup. You can still use a larger size.
okay, 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 good.
I have one more last question: is when do you need to change the cup? Like, you use it for how long? Can you use one cup and then
Like
change
for
to
how
switch?
many years, right?
Yeah, how many
Well,
uses?
Use it for up to 10 years. Unless
The
it's
same cup.
broken or there's some problem with that, up to 10 years you can use.
So like
Okay.
when can we
And
get
but
to know
there
this
are
cup is expired or we need to change it or can we use it
no, no,
whatever?
no,
manufacturer,
there
you
is a
every
section
device.
of
They
brands
come
Okay,
which
with
you
it.
so
buy.
we should go as per that manufacturing and expiry date.
Yeah, yeah. Some of it are not reusable. Some of it are reusable based on
Okay,
that.
okay. So we should check before purchasing.
Yeah, yeah. Most of it are medical grade silicone and most of it can be used for very long periods.
Yes, okay.
That doesn't cause any kind of infection or any harm. If,
As I said, has to be sterilized well, then it doesn't.
all right. Thank you. The whole discussion was very insightful. Swapnil, I hope it has been
Yes,
insightful for you as well,
yes,
and I hope your whole misconception about menstrual cups has also changed.
yes.
Uh, so I want to thank you. Say a big thank you to all three of you for joining us today, and for all our viewers, do download the Baby Chakra app for more interesting updates for you and your little ones. Thank you very much.
Thank
Thank
you
you so
so much.
much.
Thank you, doctors.
Thank you.
Thank you.
Thank you.